Hi, Dr. John Quackenbush here with my patient Donna Better. She has undergone some of my treatment protocols, brain-based therapy with exercise with oxygen, manipulation under anesthesia, and I wanted to just interview her a little bit about what we did together. So Donna, how old are you?
65.
65. That's amazing. You're a very young 65, I have to say. How do you like that, Gary?
Oh, you're a nice guy.
So anyway, when you came in to me at first, you pretty much were a mess.
I was a mess.
And you were under the impression that you had fibromyalgia, or at least you were given the diagnosis of fibromyalgia. And who gave you that diagnosis and what did they do?
That came from the Mayo Clinic. And basically, they just told me to take some drugs.
Now, which Mayo Clinic?
The one in Phoenix.
Okay. And do you know which drugs they told you to take?
They told me that something like Lyrica or amitriptyline would help.
Okay.
So I did go on the amitriptyline. And it really didn't do anything. I was still in a lot of pain. I was having muscle spasms and a lot of pain.
I gotcha. So from the beginning, when you finally decided I better go see somebody about what's happening with my body, and you getting the diagnosis, I mean, what was your life like up to the point where you got your diagnosis?
Well, there were times in my life when I could hardly walk, and I was in so much pain. And there were even, I hate to admit it, there were some times when I didn't think I could cope with the pain, and I told my husband, because I was taking some Vicodin for pain, and I didn't want to get addicted, and I was nervous about that. And I had him keeping the Vicodin for me, but I actually said to him one night, you better keep this because I don't know how much longer I can deal with this pain. So I was actually having some thoughts that were kind of scary, and I've never felt that way in my life, but I did because I was in so much pain.
I mean, were they as bad to maybe suicidal tendencies?
I think I had a few nights where it was that bad that I didn't think I could cope. I was crying to my husband, I just don't think I can live like this with this much pain, because the spasms in my back were just, they were the worst thing I had experienced. So I was kind of at the end of my rope when I came to see you.
Now, you gave the medication to your husband to dispense, not because you had a problem or you were addicted, because you were afraid you were going to get addicted.
Yeah, I didn't want to get addicted. I probably only took out of a bottle, I might have taken over several weeks period, maybe 6 pills or something like that. I was not addicted, but I didn't want to get addicted. I know the danger of that, and I was very afraid of the narcotic medications. I didn't want to abuse them at all. But then I got to the point where I thought, well, if I'm in too much pain, then if I decide to take a whole bottle because I can't deal with it. So it's sad to feel that way, but because I'm a happy person, generally, I'm very happy. But I was just at the end of my rope with pain.
And I want to commend you on 2 things right now. Number one, the knowledge that if the drugs weren't working, that you could become addicted even at prescription levels. And number 2 is that most people will go ahead and take that medication, number one, because it's prescribed by a guy in a white coat, and they just want to be out of pain and they just numb their lives down. And you sort of dealt with the symptoms that your body was letting you know that there's something wrong, and so you would curtail doing things rather than taking drugs and then trying to continue on with your life.
That's exactly
a great thing. So tell me about your life, before coming to see me. I mean, I know you love to exercise. I know that you're a dancer.
I was a dancer, and I used to love to do jazzercise or whatever, just to keep active. But I started having so many problems with mostly muscle problems. At least I thought that's what it was, that I had to give most of that up, and I wasn't doing much of anything. And I really let myself, I never got fat, but I let myself go physically. I'm lucky that I don't get huge, but I just don't get huge. But I was really out of shape, and now I'm working on getting back in shape.
And so, I mean, you just weren't able to exercise.
No, I couldn't. I couldn't even take a long walk.
And did the medical doctors tell you needed to exercise, or what did they want you to do? Just take the drugs?
No, yeah, they I don't think they knew what to do, so they just would write scripts.
And so what we've done is we've done chiropractic, which you really had a hard time accepting the idea that you were going to get your spine adjusted, correct?
I never thought I would. I never liked the idea, so I had to work on that for a while.
Right.
You helped me see the light.
Well, yeah, we did, and you know, you had a few concerns about having your neck adjusted, and we went ahead and did some specialized tests that allow you to relax and that you knew there'd be no complications.
Exactly.
And that was an ultrasound of your carotid arteries.
Mm-hmm.
Then, you know, we went through with the oxygen. What did you think when I told you you needed oxygen?
I thought I got it when I breathed, but I discovered I need more, and it really has made a difference. So I actually invested in my own oxygen machine for my husband and I because I got so much benefit from it. I wanted to have it more than just when I see you.
Right, and you know what I like about that is because it's like drinking water. You know, you can't just drink water to get well and then stop. You've got to drink water and you've got to breathe oxygen. Mm-hmm. And so tell us a little bit about your life now. What are you doing now?
Well, it's amazing because now I exercise 6 days a week. I belong to Curves. I'm a member of Curves, but now Curves has a thing where you can do Zumba. So I'm doing Curves machines, Zumba dance, which is salsa like that. And now I'm doing that 3 days a week. Then I'm taking a Zumba class at our community center, which is 55 minutes of aerobic, hard exercise. And I never would have thought I'd be able to do that again. And I'm building myself up to the point where I'm able to do that too. Then I walk with my husband and our dog, and we walk about 50 minutes, and we walk fast. And so I built exercise into my life every day. I usually give myself 1 day off.
That's excellent.
Sunday to rest.
And then there's one thing I did forget to mention. We got to a point where we were doing well, but you needed a little extra push, and that was the manipulation under anesthesia. And
I think that had a huge. I think it had a huge impact on me. I noticed it. Well, after the MUA, I stopped having the muscle spasms in my back, and those. Of course, they had started getting better, but the MUA really made a difference in that, and also freed up my shoulders because I didn't have any. I guess I had very little. What's the word?
Range of motion.
I had very little range of motion, and I have so much better now after having that done.
So how long have we been treating together?
Well, I know I had the MUA 2 months ago, a little over 2 months ago, but I think you and I have been, it's been maybe, what was it, 4 months? 4 or 5 months, something like that?
Yeah, at least 4 or 5 months.
Yeah,
but
something like
this
that.
last month you've only come in twice.
Yeah, I think maybe it has been like 5 months, something like that.
So in the beginning when you were at your worst and someone said, you know, in 5 months I could have you better, what would you have thought?
I never believed that I'd be back to doing dance and Zumba, and because I was feeling much older than my 65 years. You know, I'm surprised that I feel so well now.
Well, I'm really happy for you and thank you
I
for
am
doing
too.
this. All right.
I'm so glad I did it.
Good deal. Anesthesia for 3 days. Does it seem to get tougher? Does it seem to get easier as you do the second and third day? What would you say?
Well, going there the second day was easier because I knew what was going to take place, and when I got there, all the same people were there, and that made you feel comfortable. And as far as the anesthesia, it seemed to be faster, easier. Woke up faster. I wasn't sleepy. I went out to lunch, did a little shopping, and didn't even want to take a nap. I wasn't sleepy, and I did not feel groggy. There was no feeling that I had been drugged.
And so you didn't take a nap because you didn't want to?
No.
And you felt like going out?
I was wide awake.
And you went out to lunch with your sister or something
Yep.
that order, had fun?
Yep, we did.
Yep. Good deal.
Yep, and came back and I had a normal, perfectly great night's sleep, and I was feeling less pain already.
Excellent.
Yeah.
And so one of the things that you had just said that interests me, because I really want to see this from the patient's perspective, is the fact that you said, well, you didn't really know what's going to go on the first day. So can we talk about that? I mean, what does go on the first day that maybe I didn't tell you about, or that you would like someone to know so that they're not so afraid to be there the first day?
Well, it's a hospital environment. You're going to get those bright lights, and you're going to get everybody in masks and the hospital gear. And
The hats and-
it's a little scary for some people,
Mhm.
you know, when you see all these people walking around and then you're wheeled into the OR and you have the bright lights, the cool temperature, and everybody with the wires, that stuff.
Mhm.
You know, that's probably the worst of it, but everybody is so nice in there. You know, they have these conversations going on and you wish you didn't have to go to sleep so you could keep talking.
Yeah, that is the nice thing.
Yeah.
And it is like a hospital environment, but it's a surgical center.
Right.
And of course, the wires that you're talking about are the EKG
Yep,
leads that are
yep.
just snapped on. And then the doctor tells you when he's gonna, and they give you oxygen.
Mm-hmm.
And then he also tells you when he's gonna give you the medication.
Mm-hmm.
And you feel that, and pretty much you yawn and you go to sleep.
Right, oh, immediately,
Okay.
immediately, and easily.
Right. And then you know that you were only out for 15 minutes.
I know,
And then the second and the third day, 12 minutes.
yeah.
Right, and that's how good it went. But let's talk about some of the results you got. I mean, you are totally willing to let me adjust you in the office when you're not under anesthesia. And let's talk about like what you felt like before you went in, or the results that you got. What is the biggest result that you got?
The biggest result is I have no more lower back pain.
Amazing, that's
It
great.
is amazing. I mean, I couldn't get out of my car after a drive, and I anticipated that, and I don't get that anymore. Or standing up for a longer period of time, no backache. Walking at the end of a long walk, no backache. I mean, that's gone. The only aches I have are muscle stretch aches, like a workout, stretching. And
Now, is that from the procedure or from the stretches that we're having you do in your
it
follow-up?
was from the procedure.
Mhm.
When I felt my legs and I said, oh, they must have stretched those muscles, because it felt like I had been doing exercises.
And you were, I
Yeah,
guarantee you, I was
yeah. I'm glad I was.
there. Yeah, that's
And I
fantastic.
didn't have to go through all the work.
And thank you so much, because it's just, I like my patients to hear from other patients so that they don't have to have these big fears, because really, everybody that I've done, I've asked them about the anesthesia, I've asked them about it, and they said it was just not worth worrying about once they had it done.
Absolutely not. But you could tell them that it was a surgical environment, and what you really want.
Yeah,
You really want that,
yes, for that type of thing.
because, you know, you want that professionalism and that perfection.
Right, we have a medical doctor,
I
we have an
know.
anesthesiologist, nurse practitioner,
I know.
a practical nurse, and then
Right.
2 to 3 chiropractors, so
Yeah.
you're really getting a lot of personal attention.
I
huh?
know.
And I do like that idea that you have your own nurse for 3 days.
I know. That
Yeah.
was excellent, excellent. You could count on her to fulfill your needs at the time, you know, the little things that you might need.
Good deal,
Yeah.
thank you very much.
Okay, you're welcome. Thank you.
Hey everybody, it's Dr. John Quackenbush with my patient Brenna Becquez, and she has just undergone manipulation under anesthesia just 2 days ago, 3 days ago, right? And go ahead and tell me about what you had going on. Tell me about your hips, your back, and what was going on.
Well, my hips hurt really bad, even to walk,
Mhm.
to sleep. It was hard for me to turn over, roll over in bed from sitting. My neck, I worked with a scope all day long, so I was always tight. I didn't adjust well because I tense up.
Right, that was one of the reasons that we chose to do
Yeah.
manipulation and anesthesia. And even with you totally willing for me to adjust you, and I'm a pretty big guy and I had to use a lot of force, we could barely get your hips to go, maybe one every 3 or 4 times, right?
Yeah, I freeze up.
Right. And then we found something else out only after we did the MUA, which was you just had very terrible feet, huh?
Yes, I did.
Tell us a little bit about that.
I had surgery on both of my feet, neuromas, and I had a real hard time walking, even when I was doing the exercises that Lusa had me doing. I couldn't walk right on the treadmill because it just hurt so bad. And just from the office to my car, it would burn. The balls of my feet would burn real bad. And I just couldn't walk. Going up and down the stairs is major. I limped.
And the neuromas, like, they're right in between the bones in your feet, and then they go in and they cut those out.
Yes.
And And I remember you told me that if you found a pair of shoes that worked, you would buy
I buy
4 or
six.
5, 6
I buy
pairs,
6 pairs.
because you knew that that would work for you
Right,
to do it.
right. And I knew that if I didn't buy them that way, when I go back to get a new pair, they're not discontinued.
Right.
So I learned real quick that if I can walk on them for a month and be fairly comfortable, then I'll get 6 pairs.
So we adjusted your shoulders, your neck, your lower back, your hips, your knees, and especially your feet.
And I remember telling you when I was at that surgical center,
Uh-huh.
don't touch my feet because they hurt too much.
Mhm.
And I never told you that before, so when you went to touch it, you saw.
I remember you jumped right off the table, and then
Yeah.
we had the anesthesiologist take a look at them, right?
Yeah.
And, you know, we had discussed it would be the best thing for you, and we ended up adjusting your feet. I've been a chiropractor for 29 years. I've never heard anybody's feet move as much as yours did. And then you made a comment to me on before the second day procedure. Do you remember what the comment was?
I think I said I can walk.
Yeah, and you said you had brand new feet.
Yes.
And now we're 3, 4 days, maybe 5 days past, and you've still got all these good results.
I'm excited.
Are you sore?
Not anymore.
So how long were you sore?
What's today? Tuesday?
Today,
Wednesday?
Wednesday?
Maybe Tuesday morning I got up a little.
And how about the shoulder blade
I'm
sore?
fine.
So it was easy.
There's no piercing, cutting feeling in the back.
Now, you know, one of the things that a lot of people are apprehensive about is to actually be put under for this. And it's more of a twilight. It's not like you're having major surgery. It's sort of like you're having your wisdom teeth out.
Right.
What did you think about that? And were you scared? And
Yes, I was. Anytime you're going to go under, you know, it's like, oh, what if I don't wake up? And then that nasty IV. I think that was the roughest part, and it only lasts a couple seconds.
But even if that's the roughest part and the anesthesia was the worst part of it, would you do that? Would you do it again given the same circumstances?
Yes, I would, because I went right to sleep and I woke right up.
Yeah, you were waking up when we were just getting done. So basically you were only out for about 20 minutes.
Yes, and I was able to go home and do my thing. I was a little sore, and I kind of laid around Friday? Laid around a little bit. Saturday I did a little bit more, and Sunday I just kept back.
And you've been sleeping real good too, huh?
Yes, I have.
It's fantastic.
Yeah,
Well, thank you very much.
welcome.
All right.